Hi, this is Ben Gideon from Gideon Asen again. We're moving on to animation series 2 that we used in our endocarditis trial. And this one shows what happens when bacteria gets into the bloodstream and then goes into the heart. We also want to explain to the jury how doctors would go about diagnosing that condition and how they would go about treating it so that it doesn't lead to permanent and irreversible heart damage. So to do that, I want to show you the visuals we created for this part of the case. We start out by explaining to the jury that people can get bacterial infections that cause bacteria to go into their bodies in a whole bunch of different ways. And one way that that can happen is as simple as brushing your teeth. Everybody has strep bacteria that live in their mouths, and normally they stay there, but occasionally the bacteria can go from the mouth or it can go from some other part of the body. Let's say you get an insect bite or you um, get a cut somewhere on your body and bacteria can enter into the body. Doesn't mean you did anything wrong. It's just really bad luck. And that's what our client had. He had the bad luck that some bacteria, probably from his mouth, we know because that's the kind of bacteria that he had, got into his body. And when that happens, it's called bacteremia. You have bacteria that's circulating around in your bloodstream. The medical term is bacteremia. And that will happen. And normally your immune system will into action and will kill that bacteria, and you won't even know that it was there. All of us have that happen probably pretty regularly, and we don't even know that it did. But if you get bacteria in your bloodstream, there's always a small risk that the bacteria could seed somewhere in one of your organs, for example, like the liver, the spleen, or the kidneys, or as in our case, the heart. Could also go somewhere else, like a prosthetic knee joint. So when bacteria seeds in one of these organs, the immune system does not destroy them, but they continue to grow and form little pockets of bacteria. And then they continue to act like generators of bacteria and circulate that bacteria through your body. So you're having a bacteremia that persists. It doesn't go right away with the immune system. So we want to explain to the jury that there's a very simple way that doctors can diagnose that condition. Somebody's ill and they've been tired for a while, just not feeling themselves. They might have a bacteremia. They might have some bacteria that's seated in part of their body. And the way you diagnose that, so you draw some blood and you put it into a petri dish. And it will grow out some bacteria, as you can see here. And that's how you know that you have bacteria in your bloodstream. Positive blood culture proves that you have a bacteremia. So now we want to explain to the jury, how does bacteria in the bloodstream cause an infection in the heart? When bacteria seeds in the heart, it most often infects the valves, and that's a condition that's called bacterial endocarditis, an infection of the heart valves. So we're going to show the jury how that happens. The blood with the bacteria circulates through the heart valves, and some of it seeds onto the valve leaflets and starts to grow there. Over time, if it's allowed to stay, the bacteria will eat away at the heart valve and destroy it. But because it takes a long time, it's sometimes referred to as subacute bacterial endocarditis because it has to remain there for a long time before it can eat away and destroy the valve. It can go on for weeks or months. So the cardinal sign of bacterial endocarditis is a positive blood culture for strep bacteria. So if a patient has the blood culture and it returns positive, and like our client was feeling ill, feeling tired, then doctors know that there's a very good chance that that person has bacterial endocarditis or bacteria growing on the heart valve. So the next thing we want to talk to the jury about is treatment. How would that condition normally be treated? So in our case, our client was given um, some oral antibiotics to take by mouth. They thought he might have had a sinus infection or something because they didn't know about the blood cultures. The problem is oral antibiotics like pills, they might kill the bacteria that's circulating around the body, but they're not powerful enough to eliminate the bacteria on the heart valve. So it's actually worse than nothing at all because the medicine isn't powerful enough to wipe out the root cause, but because it will eliminate some of the bacteria in the body, it will make the patient feel better and mask the real problem. So, bacterial endocarditis cannot be treated successfully with short term oral antibiotics. To treat it requires long term infusion of more powerful intravenous or IV antibiotics, as illustrated here. The good thing is that bacterial endocarditis is very treatable. If it's identified early by blood culture, as it was in our client's case, and if that information had gotten to the right people and he had had the right treatment, he could have been cured because powerful IV antibiotics will wipe out the bacteria on the heart valve before it destroys the valve and preserve its function so that you can go back to having normal, regular heart function.